Okay, so we're going to start with Stephanie. Stephanie, what view am I in?
You are in LAO.
LAO? Am I straight LAO, LAO cranial, LAO caudal?
I'm gonna say caudal.
It is caudal. How would I know this is caudal automatically?
It's the spider
It's
view.
a spider view. Okay, this has that weird view where it looks like it's coming down at you. Okay, go ahead and have this seat. So, Vanessa is there. Yeah.
So for the exam, if it's like a short answer thing, and it looks like that, can you accept spider view?
I would accept spider view. The best answer would be LAO caudal. Because spider view is an angle. So if I say, what is the angle of this view? I want to know the angles. Does that make sense? You don't have to get the exact number. You just have to know LAO caudal, if that makes sense. If I say, what is the angle of this view? Or this view was recorded in what angle? Spider view is the name of the angles, but it is not the angle. Does that make sense? Yeah. Okay, so the spider view would not be the best answer. Okay, Vanessa, what artery is this? Okay, that is correct. Tosha, what artery is this? Very good. Kim, what artery is this?
That's not diagonal.
Very good. Agar, what artery is this? Not diagonal. So what artery is it coming off of? Yes, it comes off the circumflex. So what artery is that? Obtuse marginal. Very good. Stacy, what artery is this?
Oh, the left main.
That's an easy one, right? So we have to give her something hard. What does the left main feed?
The left main feed the anterior lateral, of the left ventricle, and then the anterior interventricular septum.
Okay.
And is that the side? No, that's the right.
One more thing.
Left atrium.
Left atrium. Has to feed the left atrium. Somebody has to feed that. Very good. Kim, you move. I'm not going, that's not fair. I'm not going to go right back to her, so you get this next one. What does this artery feed?
You said Kim.
Okay, I'm sorry, Stephanie.
I'm like, why is he looking at me?
Stephanie. Stephanie, move. Because it's the whole thing up here of you people throwing you under the bus. Now your name is stuck in my brain.
Okay, so can you point that one more time?
No. So this.
Okay, so that's the LID. So that feeds the anterior, the interventricular septum, and of the left ventricle.
Very good. Yep. And you can also add anterior lateral in there, but anterior kind of covers that. Anterior and anterior interventricular septum of the left ventricle. Or anterior wall of the left ventricle and the interventricular septum. So very good. Vanessa, what does this one feed?
That's an obtuse marginal. So it feeds the posterior
It's going to be help her out. Posterior lateral of the left ventricle. Posterior lateral of the left ventricle. Yeah, tell me what side you're on. Because there are arteries that feed the posterior lateral of the right ventricle, so we always need to know what side you are telling me. You just can't say posterior lateral because it's kind of like, I got a 50-50 shot here. You have to tell me which side you're on. Tosha, what does this feed?
That's the circumference. It feeds the posterior left ventricle, atria, and the intraventricular septum.
Always?
Huh?
Does it always feed the interventricular
No.
septum? What percentage of patients is the interventricular septum fed by the circumflex? Only.
98%.
Oh. What percentage is the the
21,
no?
12.
What's that? 12%. 12%.
Dyslexic.
Yep, 12%. That have the circumflex only feeding the PDA. It's 12%. So only 12%. And what do we call that? When somebody's circumflex is feeding the PDA, we say that patient is
Left
left
dominant.
dominant. Very good. Okay, Kim. Now, Kim. Okay. What does this artery feed? Did we ever do that one? No, okay. What did this artery feed?
The anterior lateral portion of the left ventricle.
Very good. And there's a small artery here that comes off in this direction. We didn't name it yet, Agar. What would this one feed? Really small. It's coming off right here. What would that artery feed? I'm going to dim the lights a little bit here. No, that'll come off the circumflex. This is coming off the LAD. What does anyone else think?
Septal
Septal,
perforator.
it's a septal perforator. Because the diagonals are going in this direction, this one's going in the opposite direction towards the septum. Okay. Okay, let's try another one. Okay. Starting with Stephanie now. What view am I in? Or did I start with you last time?
Yeah,
I did,
you
I'm
did.
sorry. Starting with Vanessa now. What view am I in?
Where are you?
REO. Straight REO, REO cranial, REO caudal.
Caudal.
Caudal, that's right. My ribs are fairly flat. REO caudal. Okay. Stephanie. What is that artery?
That is an obtuse marginal.
Okay. Gosha, what is this artery right here?
That's the diagonal.
Very good. Kim, what is this artery here?
Atrial circumflex.
It is atrial circumflex. It's deceiving. It's actually going away from us, but just looks like it's going down because of that two-dimensional image. It is going in the opposite direction that is, so that tells us it's going up into the atrias. Agar, what artery is this? Very good. Stacy, what artery is that?
Circumflex.
Very good. Okay. Going to Vanessa, no,
Yeah.
Vanessa.
Vanessa, that's right. Okay, Vanessa. You moving there just like it's now throwing me off.
Sorry.
It's your fault. Okay, Vanessa, what does this artery right here feed?
The atrial circumflex, so it's the left atrium.
Very good. What percentage of time can the SA node come off of the circumflex? It's a good question, isn't it?
Yes.
2%?
Was that? About 40%, 38 to 40%. If it's not who you read, there's that 2% again where they can both feed it, and people take it from the right, some people take it from the left, so 38 to 40. So which percentage of time does it come off the right? 60, and about 2% from one side or the other, depending on who you read, they both can feed it, okay? And the AV node again follows the PDA pretty close. Okay, now, Stephanie, what does this artery feed?
That is the circumflex, and it feeds the lateral and posterior side of the left ventricle.
Very good. Lateral and posterior side of the left ventricle. Does everyone agree with that? And what else? There's something else you're missing.
Is it sometimes like inferior?
Oh, sometimes that's true, but there's something that it should. Oh, it almost always feeds
The left atrium.
the left atrium. Always remember that left atrium. Sometimes the inferior diaphragmatic wall. And remember, you can use inferior, you can use diaphragmatic, or you can call it inferior diaphragmatic. They're all acceptable. You'll see that term used interchangeably, or those terms used interchangeably in resources and in journal articles. Okay, Kusha, what does this artery feed?
That's LED.
Okay,
It feeds the anterior, lateral, anterior, and of the left ventricle,
thank you.
and the septum.
And the anterior septum, that's correct, interventricular septum. Very good. Okay. Kim, what does this feed? Did you see which one I pointed at?
Yes,
Okay.
just, yeah, a blank. It feeds the posterior, lateral ventricle of the left.
Very good, very good. Agar, I'm running out of arteries here. Yeah, I did. What are these? And what do they feed? Make sure you review the rights. We're going to do rights next, but just make sure you review the rights and try to remember that you don't, those brain cells, don't drink them totally under the water. Okay. So, okay. Have a great evening. I'm sorry. Septum, that's right. Anterior septum. Very good. And Stacey, what does that feed? I think I gave you that one last time too.
It feeds the anterior and anterior lateral wall of the left ventricle, the left atrium, anterior portion of the septum.
And the posterior, don't forget the posterior portion of the left ventricle. So it feeds the entire anterior left ventricle, the posterior left ventricle, the anterior interventricular septum, and the atria. And in some left atrium. And in some patients, it also feeds the inferior one. Okay.
As far as the PDA and the AV node coming from the right, do you like 88% or 86%?
86. There's a little bit of difference there. So you'll read it in different journals, 86 to 88. It's really close. I won't ever jam you in a position where it says, put both of those answers down,
Okay.
because that 2% that is always dual. Some people take it from the left and some people take it from the right.
Okay.
So that's why you'll see with the PDA it says 86, AV node says 88. Well, it just where did they put that 2%
Right.
in that? So that's why it gets weird.
Okay. But we'll see 86 for the most part.
Yeah.
Okay.
That's what I like, and that's what I personally believe, because I really trust. I've got to meet Dr. Kern several times, and that's what he says. So I like Dr. Kern, and he worked with Dr. Grossman, who's the other vigil get, and I like them. And so if they say 15%, I'm okay with that. They're very smart individuals. So okay, I'm gonna go to the right. Which this is not gonna be on your test, but what catheter do I probably have in here to look at the right coronary arteries?
Judkins, right?
Judkins right what?
4.
4, that's right, always 4. Just remember, it's like a 4-year-old. He always wants to tell you how old he is. And then
His
they will,
birthday is, do you think I'm his birthday party?
yes. And then he'll be this many. I think 4-year-olds are the ones who really keep track of that half
Yes.
and 4.5. That half when you're 4 is important. Okay, here we go. Here's a strange question for you. I gotta ask this because there was a study that came out about this, and so now I'm just curious. Okay, so I want you to think back while I'm trying to get this positioned right. What was your favorite birthday? Of what age?
10.
10?
What is it?
What's your favorite birthday? How old were you when you had if you had a birthday, if you celebrated a birthday, what was your favorite age?
18.
18? Wow.
Probably the 21st.
21st. I meant as a kid.
Oh,
As a kid,
no.
not as an adult, as a kid.
Can't remember that far back.
Yeah, I can't remember.
The weird study they did is like 75% of people say 7 or 8.
I can't remember that far back.
That's just weird. I'm like, why that number? So I just wanted to see what you guys would say. Yeah, but like huge percentage, like a majority of the adult population say 7 and 8 when they were kids. That was their favorite.
Probably can't
Age.
remember
Past that?
younger than that, and then at that age you're into all the cartoons and the superheroes.
Oh, that's true. There's more active. That's true. Okay, here we go. Okay, what view am I in, Tosha?
Ario.
And how do you know that?
It's a C.
It's a C. So that's Ario. Where's
No,
my
C is
spine?
Oh, L.
Where's-
The spine is on the left.
Right.
So it is Ario.
Its spine's on the right, left?
Right.
What side is my spine on?
I'm
Right.
sleepy now.
Yeah.
I'm done.
So what view, that whole panning thing just fried you out, right?
Yeah.
So what view am I in?
Elio.
Elio. Spine's on the right, catheter's on the right. I make a C. C is for cookie and it's for Elio. The L is Ario, and that's just because of the sense of humor. So, Kim, what artery is this?
That's the right coronary artery.
What does it feed?
It feeds the right atria, it feeds the right it feeds the right diaphragmatic portion of the right ventricle. It feeds the right anterior portion of the ventricle, and it often feeds the posterior diaphragmatic portion of the ventricle. I don't know if you would separate posterior from that inferior portion.
It would be inferior portion of the septum and posterior inferior portion of the left ventricle.
Okay.
Because the PDA is the inferior portion. There's a faster way you can say it actually for the right. For
Okay.
the right, you can just say if he's the right atria or right ventricle, and in most patients, that inferior diaphragmatic wall of the heart and septum. Because unlike the left, which part of the left feeds one side of it, part of the right left feeds the other side of it, and part of the right feeds it in most patients, the right, nobody else feeds the right ventricle. Nobody else feeds the right atria. Who does that? The right coronary artery. That's it. So you can just say right atria, right ventricle, and in most patients, an inferior diaphragmatic wall of the septum and the left heart. And SA nodal and AV nodal, or SA nodal and AV nodal. SA nodal is in part of the right atria, so, but that is correct. It does feed the SA nodal in most patients. Speaking of which, what artery is this, Agar? SA nodal. There is one artery that usually comes off before this. It's not seen in this image. What artery is that, Stacy? Conus branch. Very good. Stephanie, what artery is this and this?
Those are RV branches.
RV branches. Very good. Tosha, what artery is this, and
Acute
this?
marginal.
Acute marginal. This actually comes off of this really wicked RV branch. If you don't wonder why I didn't point to that one connects my RV branch. So this are acute marginals. What artery is this in this direction, Kim?
It could be an atrial.
Yes, it is the right atrial branch. Notice how these are going in this direction. This guy's coming out. Remember, anything behind this is the atria. So this is coming to the atria, and this is coming to the atria. Everybody else is going towards the ventricle. Agar, what is this right here? Not acute marginal. Those would be here. This is something bigger. PDA. Very good. That's the PDA. Stacey, what are these? Posterior lateral branches. Okay, very good. Stephanie, the one that's not seen here, what does it feed?
It feeds the right ventricular outflow tract.
Very good. Joshua, what does this feed?
Esternal.
SA nodal. Very good. I like arteries that name themselves. Kim, what do these feed?
The interior portion of the right ventricle.
Very good. Anterior portion of the right ventricle. Awesome. Agar, what do these two feed? posterior inferior of the
On the right.
right. Very good. Right ventricle. Very good. Stacy, what does this feed?
The inferior septum, interventricular septum.
Very good. Okay. And Stephanie, what do these feed?
They feed the, let's see, posterior, inferior diaphragmatic wall,
Of the
right ventricle.
not right.
No.
Because
Oh,
they go
left,
beyond. Because they're
left.
beyond the septum. Remember, the PDA is the septum, so they're beyond the septum.
The left
Oh,
ventricle.
very good. Isn't this fun?
Yeah.
The one thing I want you to realize, and I'm not just saying this because I want brownie points, I'm saying this because I truly mean it. I want you to realize and think right now that really, we're in the kind of the fifth week, but really we didn't start to look at these until week 2. So in 3 weeks, not only are you able to understand the view we're in, you can name all the arteries, you can tell me what wall they're responsible for feeding, and if I ask you this next question, come on. Okay. Where do you think my blockage is? I'll give you a hint. It is in the right. Where's my blockage?
It's like that greater curve.
That's right. Is that this greater curve right here? That is where the blockage is. Okay? I'm going to take a look at that picture again. Right here, right where it narrows right there. Okay, so let's ask one last time. Let's do another round of questions, starting with Kim. Kim, what artery is this?
Right.
Very good. Agar, what artery is this? I'm sorry? Oh, this one right here. SA nodal, very good. Stacy, what artery is this and this?
Right ventricle.
The right ventricular branches, very good. Stephanie, what artery is this?
Is it acute marginal?
That is not an acute marginal. I'll give you a hint.
Oh, is that the PDA?
That's the PDA because it has these
Diagonals.
septals.
Oh, septals.
Septals that are pointing upwards. Remember, septals that are pointing upwards. Tosha, what is this and this?
RV branches.
No. This is an RV branch and this is an RV branch. These two are not RV branches.
Are they acute marginals?
They are not acute marginals. I'll give you a hint. What is
Posterior
this?
laterals?
What is this artery?
PDA
PDA, and these are after the PDA.
or posterior
They're
lateral?
posterior lateral. Okay, so this is actually curving away from you. You can't see that. This is curving away from you, and so here is the PDA, and it's curving away from you. And here's a posterior lateral branch, and here's a posterior lateral branch. He has a wickedly long RV branch. That RV branch is huge. And remember, the beautiful thing about this is that everybody's arteries are different. Okay, everybody's arteries are different. So this person has, it's kind of funny, a small right ventricular branch. Its second right ventricular branch is the biggest. And most people, their first right ventricular branch is the biggest. And that's the beauty of the heart. You never know what you're going to break. If this one closes off, I'm probably not too worried about it. If this one closes off,
Not good.
I'm really worried about it because it is so massive. Okay. Okay. What one is not seen on here again? Conus branch. And what does that feed?
Right ventricular outflow tract.
The right ventricular outflow tract. Very good.
Acute marginals aren't visible there.
No, because they are overlapped. Actually, you can kind of see one here, but it's really overlapped. This picture is not. This picture is mainly used for the mid RCA and the PDA. The posterior lateral branches and the acute marginals and the right ventricular branches overlap. So it's not a great image for those. Whereas if we go back to the right coronary arteries here, or excuse me, the LAO view. There we go. You can see the posterior lateral branches very clearly. Yep. So that's why we use, again, different views to get rid of the overlap. You'll notice this has a lot more of those dark points. And what do dark points mean again?
Coming away from you
They're
or
going away or towards you. This only has one, where that right ventricular branch is coming towards you and out. So the foreshortening and et cetera is what makes it necessary for us to do, what type of view is it, by the way, if I take it 90 degree? Orthogonal views. This is 30 LAO, this is 30 RAO. Okay, it gives me a different view and a different perspective of those arteries. Some I can see very good in LAO. This is not a very good picture of this right ventricular branch. It's coming out towards you. Doesn't look that big. It looks a little short, right? It's only about
Yeah, that's
that long.
look over there.
It's enormous. And that's what that orthogonal view allows us to see, is looks can be deceiving in one view. Okay, awesome job. Those are the type of questions that will be on the test on Wednesday, okay? So we'll be doing a setup where I will ask you 3 pieces of equipment, okay, at random. What is this? What is this? Just like today, 3 pieces of equipment. It could be part of the sheath, it could be. And then I want to make sure it's set up. I'll be looking for air bubbles in the syringes, and then we'll do the procedure. I'm going to be really watching for, by the way, not to let go of that wire, right? Once you grab that wire, once it's in, that's a big thing, not to let go of that. That's the one thing I'm really watching for when you're the scrubber for me. And then you'll have a multiple choice, short answer matching quiz over the coronaries. Sound good? You are doing an awesome job. I am very impressed. Keep up the great work. You're doing amazing. And tomorrow, or on Wednesday after the exam, if we have time, we will play more with the panning. It's just like scrubbing and setting up your back table and getting the air out of the bubbles, or the air out of the bubbles. The bubbles out of the bubble. You knew what I was saying. So went with it. The bubbles out of the syringes. It wasn't fun at first, but now you can do it fairly quickly and fairly easily. Believe it or not, panning is the same way. We just have to reprogram your brain a little bit. Okay? If you want to try it at home, turn your mouse sideways and try to click. If you have a mouse, try to use the mouse sideways and see what your brain does. Okay, that is enough for today.